cancer. So I've got a patient who has been diagnosed with chronic lymphatic leukemia. Okay? He is currently in stage 2. Even though they know he has cancer, they can't treat him because it's not big enough. It's not bad enough. So they're monitoring him until it gets to what? Stage 3 disease. And then what are they going to do? They're going to give him chemo, and they're going to bring him back to where he feels good, stage 1. Will he get cancer again? Absolutely. If all he does is just chemo and radiation therapy, because he comes back to here where he's been diagnosed cancer-free. By the way, this is what happened to my sister. She was diagnosed cancer-free, but that loss of function, those nerves are still choked, so she can't replace those abnormal cells. They continue to accumulate and accumulate to where she's re-diagnosed, and eventually it's too much, she dies, right? So every cancer patient will experience the same thing, because is it cancer that kills people? What is it? It's a lack of function. Health is 100% function and healing. Does this make sense? So, again, in the medical model, what we do is we wait until we're symptomatic. And what stage of disease are we when we can finally feel something? Yeah, stage 2, or more often, stage 3. So when we look at this, your eyes, which are of course very important, were developing in utero on your 36th day after conception. Your heart develops on the 24th day, it's functioning. Your nervous system is developing on the 7th hour. It's the precursor to everything. If we want to keep our bodies healthy, where do we want to look? We already talked about it. Yeah, nervous system. So we take our kids to pediatricians, we're going to look in their eyes, ears, nose, and throat. For what? What are they looking for? Yep, and as a symptom, is it going to show them how to get them healthy? What's it going to show? Nothing until they're to stage 3 disease, where they finally have a symptom, ear infection, cold. Does that make sense? So we have to look at this. And I'm going to let you guys pass this around. Look at how intricate God created that one thing. And by the way, that is the only system, your brain, spinal cord, and nerves are the only system that is completely encased by bone. There's no other organ. So he knew what he was doing when he created this. Now look in particular at those nerves that come out and how small those holes are. He created that very finely so that function could happen, and you can still have normal range of motion. So we talk about your brain healing cuts. Why can't your brain heal diabetes or cancer or heart disease? It can. So once that's passed around, we're going to talk about how chiropractic can help. Steph and Bombi, do you guys mind if I steal it for a few minutes and I can pass it to you later? Okay. So you all saw how intricately made this is. There's so many different parts. Okay? So if this nerve is choked, and let's just use Trish. Let's say she goes home tonight and I cut her open when she's sleeping and I choke this nerve 20%. Thank you very much, Dr. Tyler. Right?
Yeah.
She wakes up in the morning, she may or may not feel things, but eventually what's going to happen? The nerves that I just choked that tell her heart how to function, she's going to develop what? Yeah, heart disease. So now, the way chiropractic works is, we adjust it. And let's say I adjust it once. Is that going to fix her? Okay, let's say I adjust and I adjust and I adjust, and I'm slowly opening that nerve up so that power that made you and that heals you can flow right through there. Now does that heart start to, over time, heal itself? Yeah. And in 3 months, may she notice some changes? Yeah, she might. In 8 months, will she notice changes? Big time. Big time, but that's the law of healing. It takes time. All of it takes time. So the analogy we used before is, let's wait 6 years until she develops that pain. Now who do we go to? Cardiologist. And how much does he get paid for a heart transplant? Yeah, what's it worth for us to take the pressure off those nerves naturally? Is it worth $250,000? Yeah.
So do
It's
you
worth-
want us to pay you that much?
Yes, tonight. Cash preferred. To have your health that's worth everything. You can wait 5, 6, 7 years if you want, if you've got a little bit of pressure on that nerve, and you'll be taking medication, which is going to lead to more medication, which ultimately is going to lead to surgery. Or you can take action and prevent all those things and save yourself tons and tons of money. How do you know if you have a damaged nerve? How do you know when one of these nerves is chopped off a little bit? Can you, yeah, good job, you can't feel it, you have to have a nerve scan. Right? That's the only way that a person can detect how those nerves are functioning. Does your doctor, your family physician, or a pediatrician ever look at this? No, what's he do? So draw blood, he's gonna look at the blood. What does their blood tell you about health? It tells you that you're already sick. Good job. So the thing is, I mean, that's what they're looking for. They're looking for disease in those blood tests. That doesn't help you get health. They're gonna give you medicine which will mask it. Now, I am not anti-medicine. They are the best in the world at crisis care. But they're not a healthcare system. They're crisis care. If I run out and I get hit by a car, I'm glad I live in the United States because they're the best at what they do. But in terms of getting healthy, I don't want to be in there. They're the #1 cause of death in the United States. But if I get a massive infection because I didn't take care of myself, guess where I want to go? I don't want to come get adjusted. I'm going to go down to the hospital and make sure that I'm being cared for. And then I'll get off those medicines as quickly as possible. So you have to have a nerve scan in order to find out how those nerves are. Now, let's talk about the importance of curves. Again, your brain is what does all the healing. So, does anybody know what that's called?
X-ray.
Scoliosis. And an x-ray, yes. So a scoliosis, let's say it looks like this, and I'm trying to show you what we're looking at there. Does it look similar?
Yeah.
Okay, so we know that if we choke any of these nerves, that's bad. Now, the holes, obviously when I bend something like this, are those holes going to be bigger or smaller? Smaller. Are those nerves going to work better or worse?
Worse.
Worse. So let's say you went to a doctor, a medical doctor, and they saw this. What are they going to do? Surgery. What are they going to do with surgery?
They're gonna put like rods or something.
Good job. It's like you work here. They're going to put rods in. Now, a medical doctor knows nothing about getting health through nerves, but why would they put rods in you?
To straighten it out.
Yeah, but why? They know something. What do they know?
But it needs to be straight.
It's pinching the nerve.
It's pinching those nerves, and if they let that go long enough, eventually those organs are going to shut down that are controlled by these. They know that. It's shown. So they'll put rods in you to try and brace it or to straighten it out. They know that you will die if they don't straighten those out. Here's an example of someone who had to have rods. Now, if you can't move this entire section like you're seeing here, now how's that going to affect your health? You're gonna do the robot all day long, right? You can't move, you have no rotation, you can't do anything. So that's gonna cause hypermobility above and below, and that's gonna create more problems, and eventually you're gonna have to have surgery again. So let's